Hello, everyone, and welcome to another edition of HealthQuest Facebook Live. I'm Heather Asti, owner-director here at Rochester South.
And I'm Doug Schultz, owner and director of the Shelby Township location.
Right, so today we are here, Let's Talk Concussions is the name of the program today. Doug is actually our resident concussion expert. He's done all the training for the staff at HealthQuest. He's developed his own little sister company here that we're using. So Doug, tell us a little bit about how you got involved with, or interested in concussion care and how that's all evolved.
Well, I took about a year-long fellowship in concussion management and care with the intention of bringing it back to all our therapists here, as concussion is such a hot topic over the last couple of years. So I was an athletic trainer before I became a PT, so I saw quite a few concussions and saw things that I wasn't sure if they were concussions or not concussions. So in order to keep our athletes and our patients safe, be able to bring training to our therapists and all the programs we have, I decided to go and take this year-long program. So it's very eye-opening and very good. And like I said, with concussions being in the news so much now and on the headlines, whether it's the NFL or the military or any of those things, concussions is on everybody's mind. So.
Yeah, I think it really, what'd you say, in the last 10 years, maybe less, but it become a hot topic, I think, because of the NFL certainly gave it the headlines that it really deserved. As we kind of...
It's been pretty much just a 10-year process for the research of concussion. So.
Yeah, and so that's why we're here today, because I think people have a general idea of what a concussion is at this point, and maybe have some idea of what to do about it, whether it's their, a coach or if you're a parent. But we're going to kind of really dive into what the timeline, ideal sequence of events should be from time of injury to hopefully returning to sport.
Yep.
He's going to give us all the info on kind of step-by-step what good concussion care should be, what programs are available, what resources you can get to if you need them for your student or athlete, and what we can really do as parents and coaches to give our athletes the best chance at a really, solid recovery from that, right?
Right.
So I think we probably, we're going to start with defining a concussion. We're going to go through those ideal steps of concussion care. If you have questions, go ahead and ask them. Comment, like, share as always. If you want to see this video in its entirety, if you have to tune out, you can always go to our Facebook page and watch that. We also have a Concussion HQ website that you can access from the HealthQuest HQPT.com website. So with that said, what is a concussion? Define it for us, explain it, what happens?
There's been a lot of research on it, because I think the old idea of what a concussion was your brain kind of bouncing around in your head.
That's what I think.
And bruising as it bounces around. The new definition kind of is if you think of your brain like a jello mold, and if your body's moving or your head is moving and it suddenly stops, then that shakes, and that shaking or twisting and turning can stretch or tear the little axons and nerves that are in your brain, as well as its connections to your skull, and create injury. So there's a whole research process that's out there that shows all of these metabolic and cellular changes that happen with a concussion. But basically what it boils down to is there's less blood flow after the injury occurs. There's less cerebral blood flow for 7 to 10 days. And so that's really the important thing here, because you don't want to have a concussion and then go back in too soon within that 7 to 10 day window and get hit again and have a potential second concussion, which leads to even more damage than the first one. So. Okay,
that makes a whole lot of sense. But what are the basic signs and symptoms of a concussion then? And how do you know if you have one? Like if I go out on my bike and I fall off, no one's around, how do I know if I have a concussion?
That's really the hard thing. Like if you break your arm, you have a cast.
Right.
And if you hurt your knee, you might have a brace. But if you have a concussion, no one can see it. So typical signs and symptoms can be, usually the primary one is headache and dizziness. Usually some nausea. You can have fatigue. You can have difficulty concentrating, difficulty remembering. You can have sensitivity to light, sensitivity to noise. irritability, all those things. If someone's experiencing those symptoms and you feel like you suspect they might have a concussion, those are kind of the things that confirm it. So if we don't have anything other than symptoms, that really is what confirms it. So there is testing that can be done, both pre-injury, hopefully, which is considered baseline testing.
Right.
And then that can be compared. If you are an athlete in a high school or college, you probably would have had that testing done, and then after an injury occurs, they could compare those two to see if you were back to your normal level or if you were still suffering from concussion symptoms.
Right, and I think that's, the name of what I've kind of gleaned from the things that you're teaching is really this whole concept of baseline testing. I didn't know that even existed and what the purpose was. So take us through really quick, outline the ideal steps to concussion care. So obviously baseline testing would be ideal that everyone has baseline testing.
First and foremost, if you could have that, a lot of the high schools already provide that, and it's usually done through impact testing, it's called. That's just an acronym for the test, and it measures basically reaction time, memory, and balance kind of things. So it gives you a score and compares you to normative values, but what we want to do is get that score, we want to compare it to after you've been injured. And so if you don't know your baseline score, you won't know when you're back to that level after an injury. So the goal of baseline testing is to get you back to that same level you were pre-injury.
Got it.
So that it's okay to return to play. A lot of people have heard, like maybe through the NFL, that someone's on a concussion protocol. Well, that protocol is a series of steps to get them back to their baseline. So
how common is it for athletes to get baseline testing? High school sports, let's talk about. And if I'm a parent and I know that my athlete hasn't been tested, where can people get baseline testing?
We do offer the impact test, baseline testing through HealthQuest. All of our locations can do that. But a lot of schools that are fortunate enough to have like an athletic trainer. Mm-hmm. That athletic trainer is usually in charge of administering that baseline test to, usually it's freshman athletes. It really should be done every 1 to 2 years. But the trainer usually does it, realistically usually does it when they enter as freshmen, and then again if they happen to get injured or get a concussion, sustain a concussion. So
Allie Swantek has a question here. Does it matter where your concussion occurs, frontal, occipital, or temporal?
It does matter. Obviously, those different forms or different areas of the brain, like we learned, control different things. So that does matter, as well as what direction you were moving and how if you fell and hit your head to the side, your neck is going to be involved versus, it doesn't have to be a direct blow to your head. It can be that your body's moving, two bodies moving, and they don't hit heads, but they hit each other.
Gotcha.
There's been studies in the military about just a blast causing concussion injuries to the soldiers. So, but it does
have different signs and symptoms depending on
yes, and okay. we could probably dissect that out today, but might take more time than we have. But it certainly matters. If you hit the back of your head, your occipital lobe, again, we talked about it being that twisting and turning, so lots of areas can be involved. Even if you fall backwards and hit the back of your head, you would think maybe your vision or your visual fields would be affected, but depending on what the injuries are internally, and we can't really see that. No. So
that was a good question, Alan.
Yeah, very good.
Okay, so we talked about some baseline testing. Mm-hmm. So we're hoping that everyone's getting baseline testing done, but at the very least, now we're at the sideline, okay, at the game, at practice, whatever. So hopefully some sideline screening is occurring. So walk us through what a sideline screen should look like.
Okay. So there is a cheat sheet kind of out there called the SCAT-5, which just stands for the Sideline Concussion Assessment Tool. It has all different kinds of things on there. So if you suspect, and let's just say we're in a best case scenario where we have an athletic trainer on the sideline, mm-hmm. The athletic trainer is going to see the play occur and think, oh, I wonder if the person might look either confused or might be holding their head or might be lying on the ground. And so when they're, let's just say they're lying on the ground, you first want to make sure that they don't have a cervical spine injury, right? So they're assessing that first. At the same time, you're talking to them, trying to determine if they're with it, if they're conscious, if they know where they're at. Yes, all that stuff.
All that stuff, yeah.
If you determine all that stuff is fairly good, then you can get them up and move them to the side. And at that time, they will be asking them more questions like memory things, like here's 5 words. I'm going to tell them to you. I want you to say them back to me, and then we're going to do some other assessment, and then I'm going to come back in 5 minutes and ask you those. And same thing, they'll do numbers in reverse and forward order, memory tasks with that as well. And I always like to see them screen balance too, because if you're putting someone back into a soccer game or a football game and their balance is affected, the likelihood of them sustaining a different type of injury is, pretty high.
Okay, so that's best case scenario. There's a trainer present, doctor, PT, someone's on the sidelines to do that testing. So what should somebody do in the event that, they're at a practice or they're somewhere where there's no trainer or any trained professional? What do you do at that point? Yeah,
if you're a coach, again, in the state of Michigan, we're supposed to remove an athlete from play if a suspected concussion has occurred. So that coach should, again, if they're lying on the ground, you want to do whatever is in the best of your ability, assessing, making sure you think it's safe to move them before you do with their potentially being a neck injury. So if it's a neck injury, obviously you want to call 911, right? You don't want to mess with that.
Right.
If it's not, and you feel like, or the athlete's already up, or they didn't actually stay down on the ground. The other thing in the state of Michigan, they do offer some concussion training for all coaches, volunteers, parents. Within the state, if your kid's going to play, yes, and so they have a little bit of training already that they're supposed to do for each athlete. But the coaches should have some idea of making sure that the athlete is with it and being able to ask them where they're at and some of those orientation questions, and then really just kind of keeping them out and monitoring them and seeing how they're doing. So if anything were to deteriorate further, obviously you could call a parent, have them take them to the emergency room, whatever it might be. But that would have to be in a very severe, case where they're actually deteriorating mentally. So,
Alicia's asking a question about how soon after your injury do people typically experience their symptoms, or could it take time to notice concussion symptoms?
It can take time. It can take that 48 hours, which is why we recommend once somebody's had a concussion, you're supposed to take a relative rest period, relative meaning 24 to 48 hours, where you're not scrolling on your phone, where you're not on your computer, where you're not doing work or school tasks. You're resting, you're letting your brain rest and kind of let things settle out and see what symptoms you really have. So they don't always happen right away. Sometimes it's not until later in the evening after a game or the next morning when you wake up. That they notice, I kind of don't feel right, I kind of feel foggy, I'm not sure, what happened last night. Those kind of things sometimes take a little bit of time.
Okay, good question, Alicia.
Yep.
So we got through the sideline screen, so let's assume that, this athlete has been concussed. So then what is the next step for that athlete? What do they have to do to kind of move themselves through the protocol?
So just like being a parent myself, I always think about what should I do. The first 48 hours are key, so you're watching them. The old school was people used to wake people up every couple hours and check on them. That's not normal anymore. You should let them sleep as much as they want. Sleep is the way that your brain heals. And, sleeping a little bit more than normal is not uncommon. So you're watching them, but you do want to notice anything like, again, deteriorating consciousness, more irritable, obviously persistent vomiting, if they seem sluggish or slurring their words or really confused. Those are kind of all red flags that you may want to, go to that next level of care, which would be the emergency room or your primary care physician and have them checked out. So,
which one do you think is, emergency room, primary
well,
care?
if you're having those red flag symptoms, I would definitely take them to the emergency room. And that first 48 hours is key. So you're kind of monitoring them as a parent or as a significant other of somebody, kind of watching what happens that first 48 hours. And remember, during that first 48 hours, that person is supposed to be resting.
Right.
So they're not supposed to be up and active and doing all this stuff. Exercise and activity is very important to start quickly, but not within that first 48 hours.
Absolute rest. Like
absolute
no
rest.
Electronics, no.
Correct. Limited phone, limited computer.
On the driveway,
No, you shouldn't be running. You shouldn't be, listening to loud music. You shouldn't be, probably won't want to do that, but those are the things you want to rest from.
Okay.
So.
All right. So we've talked those first 48 hours. We've talked about rest. We've talked
Yep.
about red flag symptoms to go, to the emergency room or your primary care physician for. So then what happens after those first 48 hours? Then what do we do after they've had that period of rest?
So they need to be reevaluated. Let's say they were injured in a game, they were pulled out, and then what has to happen in the state of Michigan is the physician needs to clear them to come back. So if you're in a best case scenario where you have an athletic trainer at your school, the athletic trainer, hopefully you get the athlete to go back in and see them after 48 hours. And they would reevaluate all their stuff that they already checked on the sideline when the injury occurred to see how much better they're doing.
Okay.
If they are doing better, a lot of symptoms can take 3 to 5 days, and then they're feeling a little bit better. That's probably, and according to the research, like 80% of people get better in that 3 to 5 to 10 day period. But there's the other 10 to 15 to 20% that can take a little longer. So that trainer is going to want to reevaluate them and kind of determine if they need to go to a primary care like sports medicine physician so they can be further evaluated for what's going on. So
then what can the athlete's activity level be? So they've passed the first 48 hours. They're kind of in this reevaluation phase. It could be 3 days, 5 days. What are they allowed to do during that time?
That's really a good question because it's a little bit of a gray area, right?
Oh, okay.
So they, again, if everything happens according to plan, you would maybe be injured on let's just say a Thursday or a Friday night at a game, and then you'd want to be back by the next week. And so all those steps are very important to happen at exactly the right time so they can be ready. If that's the most important thing to the athlete. Again, the most important thing should be that they don't have symptoms, right?
Correct,
so
right.
It might be a 2-week process, but after that first 48 hours, they get reevaluated, and they really, until they're clear. So if that physician clears them after that 48 hours, they can start light aerobic activity for the first day. And
light activity.
And so it's supposed to be like 70% or less of your heart rate, like maximum. So
so that's pretty light for most of our athletes. They're usually going a little harder than 70% of maximum.
And there is a set process that's supposed to take around 6 days so that you can slowly get back and return to play as quickly as possible, but also as safely as possible.
Okay, so then if we hit that 3 to 5 day mark, and we're beyond that, what are some options that people have, or what is out there to help move someone through this recovery process?
So a lot of times the physicians will just have you try some things and have you kind of wait it out, because a lot of these things will just kind of dissipate over time. It's just hard to predict if you're going to be one of those that gets better in the first 24 to 48, or whether it's going to take you a little longer. It may depend on if you've had a previous concussion. Sometimes that is a factor. Like one of our questions, how you were injured may determine that it might take longer or not. And so it's really hard to know. Usually in physical therapy, we don't see them for about the first month, because the doctors like to let all those symptoms kind of see where they're going to be, and then allow us to kind of dive into specifics of where they might be having trouble.
Excellent. So what kind of things, as far as being able to return to school and sport then? So we talked about that kind of gradual progression, light to moderate activity and slowly progressing. And then how do they get that green light to go back full speed into sports?
Returning to school is a little bit safer than for the athlete than returning to sport, because they're hopefully in school not going to get concussed again, right? And so that involves, after that initial period of rest of 24 to 48 hours, they can start doing some of their homework at home. And then if that goes well, then they do maybe a half day at school. Again, all this depends on their symptoms. So if they're not really having any symptoms, they can go back to a full day of school. But if they're struggling a little bit, then obviously communication with the teacher is key. Making accommodations for the student, whether it's a half day or giving them a little longer, letting them take a test maybe in a quiet area where there's not a lot of distractions. We talk about that sensitivity to noise and sensitivity to light. Sometimes that bothers kids returning to school. But that's a little quicker process than return to sport, because return to sport is going back to the activity that they potentially may have gotten injured at to start. So
Allie has another follow-up question there. Can you have long-lasting symptoms from a concussion?
Yes, you can. That's kind of where we get involved as physical therapists. So like we talked about, that first month, they kind of let things kind of settle and see where you're at.
Mm-hmm.
You may be seeing the doctor a couple times. He or she may run a couple other tests. But then we can dive in and see if there's issues with your cervical spine that aren't clearing up, that are causing dizziness or headaches. We might be able to look at your eye function and see how that's affecting your vestibular system to help push things in a positive direction.
Yeah.
So, but yes, there are potentially long-term effects, and especially from multiple concussions, which is the main reason, again, we would see athletes and not understand all of this stuff. And so getting the word out there that if you can avoid it, you want to be completely healed after a concussion, so that when you return, you're not going to have a chance of getting a second one, leading to, back-to-back concussions that are the most dangerous and leading to those long-lasting symptoms.
Right.
So.
Good question again, Allie. Okay, so we kind of outlined the ideal steps in concussion care,
Mm-hmm.
what that should look like, who you can go to, who you should see if you have questions or concerns. We talked a little bit about how PT fits into that if they're not resolving through some of those steps, or it's taking longer for them to feel better. And then you have developed, as our concussion guru, Concussion HQ, which partly involves education of our therapists and staff. So you can talk a little bit about that for a second.
Sure.
As far as what that program is, and then what the program is for you.
We wanted to put something out there that had a lot of information on it for patients, parents, coaches, families, RPTs, all that kind of stuff. So it's been a work in progress. It's still a work in progress because it's ever changing, right? The concussion, with it only being 10 years old, the research is changing. And so we're trying to keep that up to date. It is an avenue where you can find out information. It's an avenue where you could book a baseline test if you wanted to at one of our concussion locations, or any of our HealthQuest locations, really, that have been trained with the concussion management. So, but really it's just another resource for everyone. So, and allows people direct contact to any of us, so that we can do potentially free pain assessments, or potentially see them as a patient if they're having further difficulties. So
yeah, so that website you can access that from our company website, so hqpt.com, and then you can look for the Concussion HQ link. That's what Doug was talking about, where you can book a baseline test and kind of get some more information on the program there. All of our locations do free assessments for anything, if it's concussion or injury or pain otherwise.
Right.
So you can always book that online or call any of our locations for that. I think that kind of wraps up concussion. Anything else that you think we missed?
No, I just think it's interesting that, like I said earlier, that think about a patient or an athlete that's had a concussion and what they're dealing with, because you can't see them in a cast.
Right.
You can't see them in a brace. And so their teammates and their coaches don't know what they're feeling. And so what better patient to help than that, get them back on track, give them the resources they need, give their family the resources they need, so that they can get back to where they need to be, because it's an injury that has many symptoms, as we talked about, and varying symptoms for varying people. And so just having the right information and providing them the right treatment, being able to focus in on what they need is the key. So that's why we do what we do.
Yeah, so thanks to Doug for coming today and sharing all of his information on concussions. And like you said, you can get updates through the webpage. If you enjoyed this, like, comment, share on it, post it to your Facebook page. You can always come back to the HealthQuest Facebook page and watch the video again, or direct other people there too. It's been a pleasure. Thanks, Doug, for sharing what you know. And tune in again. We'll have another Facebook Live soon. Take care, everybody.
Great.
Ta-da!
Not too bad.
You did great.
I think it was okay.
I think it was great. Yeah.